Is bladder health research focused more on cancer or non-cancer conditions? When we look at bladder health research, a key question arises. Is the focus more on cancer or non-cancer conditions? In recent years, bladder cancer has taken center stage in research. This is largely due to the significant funding and resources allocated to understanding and treating this disease. Major research grants and initiatives are often directed specifically at bladder cancer. This focus highlights the urgent need for better detection, diagnosis, and treatment options for this serious condition. Organizations that fund cancer research prioritize bladder cancer because of its impact on public health. The mortality risk associated with bladder cancer drives the need for innovative approaches to improve patient outcomes. For instance, there are substantial funding opportunities available for projects that aim to advance the field of bladder cancer research. This includes everything from clinical trials to studies that explore new treatment methods. However, it is important to note that bladder health research is not solely about cancer. There are many non-cancer conditions that affect the bladder, such as urinary incontinence, overactive bladder, interstitial cystitis, and urinary tract infections. These conditions are prevalent and can significantly affect a person's quality of life. Research in these areas focuses on understanding bladder function and developing effective treatments. Despite the importance of non-cancer bladder conditions, they generally receive less concentrated funding compared to bladder cancer. This means that while these conditions are being studied, they do not attract the same level of high-profile research grants or initiatives. In summary, bladder health research encompasses both cancerous and non-cancerous conditions. However, the current landscape shows a stronger emphasis on bladder cancer due to its severity and the availability of targeted funding. Non-cancer bladder conditions remain as crucial areas of study, but they tend to have less dedicated large-scale research funding. This focus reflects the need to improve outcomes in bladder cancer while also addressing other bladder health issues through ongoing research efforts. Always remember, if you have concerns about bladder health, consulting a healthcare professional is essential for personalized advice and treatment options.